Policy Visibility Drive, a Ghana Health Service policy initiative created to shed light on existing policies within the service. This month, we'll be focusing on the following policies: the Patient's Charter, the Ghana Health Service Staff Welfare Benefits, and the Workplace HIV and TB Policy for the Health Sector 2020. In our last presentation, we took a look at the staff welfare benefits. In today's presentation, we will concentrate on the Patient's Charter. This presentation will be broken down into two parts: the patient's rights and the patient's responsibilities. The Ghana Health Service requires collaboration between health workers, patients or clients, and society. Ultimately, the attainment of ideal healthcare is dependent on teamwork. Facilities must therefore provide and respect the rights and responsibilities of patients or clients, their families, health workers, and other healthcare providers. The patient's rights are: the patient has the right to quality basic health care irrespective of his or her geographical location. The patient is entitled to full information on his or her condition and management and the possible risks involved. The patient is entitled to know of alternative treatments and other healthcare providers within the service if these may contribute to improved outcomes. The patient has the right to know the identity of all his or her caregivers and other persons who may handle him or her, including students, trainees, and ancillary workers. The patient has the right to consent or decline to participate in the proposed research study involving him or her after a full explanation has been given. The patient has the right to privacy during consultation, examination, and treatment. The patient is entitled to confidentiality of information obtained about him or her, and such information shall not be disclosed to a third party without his or her consent or the person entitled to act on his or her behalf. The patient is entitled to all relevant information regarding policies and regulation of all the health facilities that he or she attends. Procedures for complaints, disputes, and conflicts resolution shall be explained to patients or their accredited representatives. Hospital charges, mode of payment, and all forms of anticipated expenditure shall be explained to the patient prior to the treatment. The patient is entitled to personal safety and reasonable security of property within the confines of the institution. The patient has the right to a second medical opinion if he or she so desires. Let's talk about the patient's responsibilities. The patient should understand that he or she is responsible for his or her own health and should therefore cooperate fully with healthcare providers. The patient is responsible for providing full and accurate medical history for his or her diagnosis, treatment, counseling, and rehabilitation purposes, requesting additional information and/or clarification regarding his or her health or treatment, which may not have been well understood, complying with prescribed treatment, reporting adverse effects, and adhering to the follow-up requests, informing his or her healthcare providers of any anticipated problems and following prescribed treatment or advice, obtaining all necessary information which have a bearing on his or her management and treatment, including all financial implications, acquiring knowledge on preventive, promotive, and simple curative practices, and where necessary, to seeking early professional health. Maintaining safe and hygienic environments in order to promote good health. Respecting the rights of other patients or clients and health service personnel. Protecting the property of the health facility. Kindly take note. These rights and responsibilities shall be exercised by recognized representatives on behalf of minors and patients who are unable for whatsoever reasons to make informed decisions by themselves. In all healthcare activities, the patient's dignity and interest must be paramount.
Please note, this presentation only contains an abridgment of the policy document or publication. To access the full document or for further reading, kindly visit the service website at www.ghs.gov.gh. Thank you for your time and attention.